Several places are still far, far away from ending their epidemics, and in fact are seeing their epidemics increase. And that's what I'm focusing on. Asking the question, why? And who's there on the ground trying to fix things. My name's Jon Cohen. I'm a staff writer with Science Magazine. The Pulitzer Center funded travel for this project, which also involved a collaboration with the PBS NewsHour. I've been covering the epidemic around the world now for nearly 30 years. When I began doing this, I'd go on trips to other countries and see warehouses full of people dying. I don't see that now, but I do see places that are struggling to use the very powerful tools that exist, both to help keep people alive and to stop them from spreading the virus to other people. About 1 out of 4 mother-to-child transmissions in the world happen in Nigeria. And Nigeria has had billions of dollars of foreign aid poured into the country to help solve the problem. So what's wrong? The big problem is so many pregnant women never intersect with healthcare. They either give birth at home or they have a traditional birth attendant. But she's not necessarily a trained healthcare professional who's going to do HIV testing. So one of the creative things that Nigeria has going right now is a project working with traditional birth attendants. I met with a traditional birth attendant, Mama Meta, and they have trained Mama Meta to encourage women to come to her clinic on a day when an HIV testing group shows up. And she also knows that if a woman does test positive, that she should transfer her to a hospital or a regular clinic for care. So that's one of the progressive things that's happening in Nigeria to try to really isolate a problem. About 90% of Nigerians go to services on the weekends, whether they're Christian or Muslim, and the country's about 50-50. So a project has begun called Baby Shower, where they go to the churches and they have the priests say, all pregnant women and their partners come to the front for a special blessing. And then the priest says, after the service, we're going to have health testing here. We're going to check you for sickle cell anemia, and we're going to check you for hepatitis B, and we're going to check you for HIV. HIV is just wrapped up into this because there's so much stigma and discrimination. People might not come for an HIV test, but for a health test with all these things, they'll show up. And they get a gift for their baby and for their birthing. And then if a woman tests positive there, they link the woman to care and they make sure that she gets on antiretroviral drugs, her baby receives the treatment to stop transmission. And it's a full package to try to address the problem.
The Baby Shower is producing some amazing results. It sprays like perfume. You can spray it here. Somebody else somewhere, So what is that? And comes looking for what it is. Once they get into the village, you see others running and coming. Oh, the baby shower is holding today, this, that. The perfume is spreading. The fragrance is going everywhere.
Russia accounts for 80% of all the new infections over the past 5 years in Eastern Europe and Central Asia. And it has about 10% new infections a year. Something's really wrong. Well, what? What's broken? Well, Russia only has antiretroviral drugs reaching about 1/3 of the infected people. That's a big problem. They do not promote needle exchange programs. They barely allow them. So the Russian epidemic has just been growing at a time when it's dropping everywhere else in Europe. And in that harsh political environment, HIV-infected people and advocates have created a pharmacy, sort of an underground pharmacy, to supply infected people with drugs when the government runs out of drugs. So they collect these antiretroviral drugs and redistribute them to people in need.
This is for free. Just help each other.
When I did a just completely unbiased look at the data, what's happening in the United States, Miami has more new infections than any city in the country. That shocked me. And then when I looked at the top 10 cities in the country, 4 of them were in Florida for the new infection rate. Florida has basically every driver of the epidemic that we know of in the United States. high rate of infection in men who have sex with men. It has people who inject drugs.
Public transportation isn't really what it should be, and then our rural areas are even more challenged.
Homelessness, mental health, ethnic disparities all get in the way of us dealing with the epidemic here.
It's a challenge under the best of circumstances to get appropriate messaging, to get people into care.
The Haitian community, for example, a lot of people don't speak English. They speak Creole. So, to reach the Haitian community, a radio program has a health section that just goes after that Creole population, and it's a way to specifically get them HIV tested. Here's a clinic in Little Haiti that has people speaking Creole. They'll pick you up at your home and take you back and forth. We know if you are treated with antiretroviral drugs and you drive your virus in your body down to levels that are undetectable, your odds of transmitting that virus to someone else are exceedingly low.
Myself, I take my meds all the time. So I have become undetectable.
That's at the heart of all these efforts, is get everyone tested, get everyone who's positive on treatment, and getting everyone who's at high risk to lower their risk, to do something like needle and syringe exchange programs, or pre-exposure prophylaxis, which is a pill usually used to treat HIV that can prevent HIV. That's what's needed to really break the back of the epidemic. And there's a whole lot we can do today.